This is part 3 of the lesson, Health and Medical. So the last sentence we learned was, the funeral is Saturday. So next sentence, he died of a heart attack. He died of a heart attack. Died, died. Just the flat hands, died, died. Heart, feeling hand, finger, just touch your heart. Heart, attack, attack. Just the S, attack, attack. Next sentence, is Don still depressed? Is Don, or the person's name, still depressed? So is Don still, I'm doing this, the Y finger, still, like you and I, or this could be still, continues. Just use my two thumbs on top of each other, continue. Still, is she continuing to be depressed? Is she still depressed? And just use your fingers and go down, down. Remember, this could be life. Going up would be life or live, and depressed would just go down, and you'd probably use your facial expression, depressed. So sentences, is Don still depressed? Is Don still or still depressed? Next sentence. Her emotions are better or worse. So her, or she, and point to a person, her emotions are better or worse. Emotions are E hands and just circling. Emotions, emotions, emotions. 2 E hands, emotions are better, better. I just got my flat palm kind of around my chin, straight across into a fist. Better, better. A best would be very similar but higher. Best, best. So better, best. Better, best. Best would go higher. It's even better. Better and best. Again, the sentence is, her emotions are better or worse. So her emotions are better, and then worse would be with V fingers, V, or with W's. Again, if the person that you're assigning to prefers or understands and initialize words, use the W, worse. If not, just use V. Worse, worse, worse. So the sentence again is, her emotions are better or worse. Her emotions are better or worse. Next sentence, she has pneumonia. She has pneumonia. Pneumonia is P fingers, just touching your chest and rocking up and down, pneumonia. She has pneumonia. So remember, pneumonia is in your chest area. So the P fingers, touch your chest, pneumonia, pneumonia. Next sentence. Do you need help? Do you need help? Help? Remember, right fist in the palm of your hand and lift it up. Help, help. Next sentence. Who is your doctor or dentist? Who is your doctor or dentist? Who, circling it, or I've also seen who. Who or who? Who is your doctor or dentist? The D at your teeth, dentist. Next sentence. Ray needs glasses. Ray needs glasses. Glasses. I feel dizzy. I feel dizzy. Feel, remember the feeling finger at your chest? Feel. As you do, just keep it at your chest. Don't come out or don't roll it out. Feel. Feel. Dizzy. Just like the open curved fingers, dizzy. So I feel dizzy. Next sentence. Drive me to the hospital. Drive me to the hospital. Drive, it's like a car, me to hospital. Remember the cross on the jacket of a hospital worker usually has a red cross. Hospital. I'm just using an H or two closed fingers. Hospital. Drive me to the hospital. He is restless, quarreling, and drunk. Or maybe all three at the same time. He is restless, quarreling, and drunk. He is restless. Just got my curved fingers. Restless. It's like you're in bed on your back and you turn over and you can't get comfortable. Restless. Restless. Quarreling. Like two people, this person talks, quarreling. Quarreling. And drunk. I'm using a Y hand like you're drinking. Or I've also seen it as just the A hand with the extended thumb, drunk. Drunk. Of course, this would be like intoxicated, drunk. Drunk or drunk. So the sign for liquor is liquor, just the horn shape on top of each other. This is liquor, very similar to drunk, which is the Y. Like this is the mouth of the bottle and that's the end of the bottle, I guess. Drunk or just drunk. So the sentence is, he is restless, quarreling, and drunk. He is restless, quarreling, and drunk. Next sentence. That is poison. That is poison. That is just the Y in your palm. That is poison. Again, the P, like same, circle your palm. Similar to medicine. Medicine, you use your feeling finger, circling it. Medicine. Remember like the mortal and the pestle, how they used to grind pills? Medicine. Or P for poison. Poison. So the sentence is, that is poison. That is poison. Next sentence. The operation was successful. The operation was successful. Operation, remember just the A, extended A hand. Operation. Operation. Or again, if the operation's in your neck or your shoulder or your arm, you would point to that. But in general, the operation was successful. I'm just doing index fingers in a little circle and stopping up. Successful. 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 Now this is a little bit different than famous. Famous, you would just go out and stop. Famous. Successful, you go out and up. Successful. So the sentence is, the operation was successful. The operation was successful. Ended up in a good result. Next sentence. Don't cry. Not cry. Not cry. And sometimes you close your eyes or just look down. Don't cry. The nurse gave the patient a shot. The nurse, I'm just showing you what I'm doing. The in, nurse, gave, I have it here and I'm giving, or it could be just give or give, same as give or gave the patient, P, I'm using a P, patient. So the two fingers and a cross is hospital. The P would be patient. The patient a shot, just like you've got a needle and getting a shot. So the nurse gave the patient a shot. Nurse gave patient a shot. Why? Let's touch it and come out into a Y. Why? You could also use your WH words, who, what, when, where, why. You would, especially if you're asking a question like why or where or what, you would kind of wrinkle your eyebrows right here. So why? I've also seen a why is just like this. Why? Or why? Next sentence. I have a stomach ache. I have stomach ache. I have stomach ache. Just kind of touching my stomach. Ache is the same as pain or hurt. Stomach ache. And then there's several things. The rest of these words are like at the end of a sentence, like I have a. So it could be a stomach ache, a sore mouth. So a sore mouth. Remember sore? We just kind of did the S and kind of rolled it. Or again, a hurt mouth. A disease would be the same as a sickness. So if the sentence says, I have a disease or a sickness or a disease, and then you would explain what it was if that was your intent. Prescription, same thing as medicine. Prescription, again, I'm circling it with a feeling finger. Prescription. Cold, not like the temperature cold. That would be temperature cold, like I am cold. But in this context, we're talking about I have a cold. So it's like you just take your nose and pull it down, cold, like you're wiping your nose. I have a cold. A high fever. High fever. So high, of course, like it's going up, high. Or I've also seen initialized high, H-I-G-H, high, or high fever. This is like the thermometer, and the reading on the thermometer is going up. So you're saying high fever. Now this is similar to the sign for month. Month, you just come down. Month. Fever, because temperature is going up and down. Month and fever. So the sentence would be, I have a high fever. I have a high or a high fever. Again, high initialized for that type of audience, or high fever. Hearing aid. Hearing aid. Of course, like something in your ear. Hearing aid. And you just roll your wrist. Hearing aid. This would be here. This would be hearing aid, like something in your ear and on the back of your ear. Hearing aid. And next page. My feet hurt. My feet hurts. So my feet hurt. So feet is you're just pointing down. Feet, feet, and then hurts. Hurts. As I do hurt and pain, I'm kind of rolling my wrist. Hurt. Or you could just do without the rolling. So my feet hurt or hurts. If they really hurt, you'd roll your fingers together. My feet hurt. Again, these are just parts of the body. So eye, head, head. So this would be your whole head, head, hands, hands. So it's like you're showing your hands. I've also seen it like this, just like you're cutting off this part of your body. I'm showing you my hands, or it could be on top, hands, just kind of like pointing to them. Hands or hands. Nose, of course, you just touch your nose. Ear, touch your ear. Arm, arm, arm. And I'm just starting here and going down to show part of the arm. Arm, arm. And of course, if it's your shoulder, you would point to your shoulder. My shoulder hurts. Or my arm hurts. And if it's up here, you just say, my arm hurts. Let's see, lips, lips, body, body. So you're showing your whole body. Now this is different than depressed. Depressed, you'd go down. Body would just kind of touch it and kind of go down or kind of roll it a little bit. So this is depressed, more of a curved hand, depressed. This is more with a flat hand, body, body, or body. Then teeth, teeth. And that's the end, or the end of the lesson, health and medical.